when it comes to health and disease or anything else that has to deal with our body, you'll find tons of recommendations in the web or in social media. And unfortunately, most of the time, all these recommendations forget to mention to whom they want to apply. So most of the time, people think it has to work for everyone. Now, if you are coming from a precision medicine perspective, this sounds a little bit difficult. The probability for that is quite low. And I would say my message is get real. There is no one size fits all. Not in medicine and most probably also not when it comes to biohacking. A biohack will work for a certain percentage of people and another certain percentage it won't work so well for most. And now let me tell you why I claim this. I start with pain. In medicine, sometimes we use MRI and sometimes we use functional MRI, and this teaches us about the anatomy of the brain. And we can also see how pain is processed. This is not only headache, but all kinds of brains. And when we apply an artificial intelligence or machine learning approach to hack vast amount of data, recently several results were reported identifying a certain number of brain regions where you can make a distinction, leading to different kind of pain processing. And this means, as you may all know, from you have pain and you take different types of medication. Some medication works for you and other medication does not. And among several reasons, one reason is differences in the anatomy in the brain, in the structure. And of course, this has to do sometimes with genetic differences. Another problem when you want to treat someone for pain is it's difficult to compare pain of different persons because it's difficult to measure and you have to rely on what they report, and that is anything but standardized, which leads to a high inter-individual variability. People have tremendous differences along a certain spectrum of pain. And that is the message that we see from this research that has taken place in the last 2 or 3 years. The next thing I want to talk about is the immune system. Everyone knows about the immune system, but people are not aware where is always the immune system involved in. This is, for example, how you process your diet. This is how you regenerate after sport. It's not completely the causality at all, but there is an immune function in regeneration. It is even when you had a surgery or after birth, how you regenerate, how you're maybe, yes, you may get an infection or not. That has to do with the immune system. And this immune state can be influenced by genetics, or it can be also influenced by environmental factors. So the immune state is highly variable. There is no person on earth who has exactly the same immune state. This also, for example, applies when it comes to diabetes type 2. Type 1 is an autoimmune disease, or something different like atherosclerosis. Now, immune system obviously is quite important, as we have learned in the pandemic, and it is strongly influenced by the genetics. So that's why I have 2 questions to you people in the audience. The first thing is, do you have siblings? And if you have siblings, would you say your siblings are different than you? I would please, if you have a sibling that is different from you in behavior or anything else, raise your hand. Could you do me that favor? Okay, many people with siblings that are different. Now that, I guess you have the same parents, but obviously you're different. The next question is, as we are here in biohacks, do you have a wearable and do you quantify yourself? So whatever it is, a smart watch, like an Apple Watch, or a Wi-Things, or a Fitbit, and so on, please raise your hand if you quantify yourself. Okay? There are more different siblings than quantify yourself people in the audience. Anyway, so you see, you're not only different in the immune state, but also obviously you're different from your siblings. You share the same parents. I will talk about this later. When it comes to the immune system and the difference in the immune system, you should be aware that this thing is important and influences many things in health and disease. Here I have some examples when it comes to disease. Cancer, autoimmune diseases, your cardiovascular system, your kidney, diabetes and inflammation, the way you age, your longevity is also influenced by the immune system, which is in part due to genetics, also gene regulation, epigenetics, but also genetics. If you pick Alzheimer, Parkinson, your mental well-being, even how you react to infections, or how your microbiome is built in the gut or on your skin, in your nose, that has to do with the immune system. And of course, if you want to run multi-omics, whatever it is, metabolomics, epigenetics, all kind of data classes, and you apply an AI, you will see that there are differences in the immune system. Now, if already these fields are influenced by the immune system, and you can measure considerably differences among patients who suffer from such a disease, and they respond differently to treatments, then my question is, how can we expect that a biohack will work for all these patients, or before they got the disease, to stay healthy? So there might be some where a biohack works, and maybe others who it won't work. And now I come up with some more examples. We have heard a lot about the microbiome already, and also about epigenetics. And I promise I won't talk about epigenetics in my presentation because you had it already so much. Sometimes the dose makes the poison. But when it comes to the immune system and the microbiome, the fun fact is that it's a bidirectional crosstalk. On the one hand, the gut microbiome especially influences the immune system, but on the other side, the immune system also influences the microbiome, especially the gut microbiome. You can see this in autoimmune diseases like irritable bowel disease, for example, or Crohn's disease, where a certain genetic makeup in an immune-related gene is an important factor on what kind of gut microbiome you have. And you can eat what you want. It is a tough job to change your microbiome in certain aspects because it is predetermined by your genetic makeup. So that are two randomizers. The immune system with its high complexity, multiples with the gut microbiota and other microbiota on your skin, your nose, and especially your oral microbiome. And we have some earthly thing. I will talk about this later also, but you see it already in neuroimmunology when it comes to Alzheimer's, for example. We have genome-wide association studies, means huge cohorts of 10,000 or even more patients. And you see that there are tremendous differences among the participants. It depends sometimes when you measure the whole thing, whether it's in the morning or in the evening. Now, I don't know how many people of you take a sample from the gut microbiome in the morning before breakfast and maybe after lunch or after dinner. I can tell you, no one does. But those who did in a research project found out your microbiome is different in the morning and different from the evening. There are, of course, shared patterns, but there is differences. And it also has to do with your environment. Is it hot or is it pretty cold outside? That translates to spring, summertime, and wintertime. So what we need from research, most of the time it is not recorded in which season the microbiome was taken. That is a problem. The next thing is the second important niche for the microbiome and variability between individuals is the oral microbiome. You find pathogens from your oral microbiome downstairs in the gut, and believe me, they didn't raise up, they went down. And there are differences between males and females. So the consequence is that some biohacks won't work for females, that work for males. That has a variety of biological reasons, but you can measure that in any ethnicity. It comes even to infections. Your genetic makeup explains up to 50% the severity of infections depends on your genetic makeup, not on your gene regulation. Okay, on the right hand is a dentist who is working on that. Originally, I wanted to play a short video from her, but as my speaking time was reduced, I skipped the video. I hope you can see the presentation somewhere in the web later. But the message is the genetic makeup has influence on the severity of oral infections. And that is a huge variability. Then we have some unearthly things when it comes to make a lab test, maybe a consumer test or whatever. You should be aware that it depends on the lab where your sample is analyzed that has influence on the results of your test. And that is why people in microbiome research struggle to replicate study results from other researchers. And that's why often we don't know exactly, now what is the ground truth? Like in science, microbiology has one huge problem. Quite often we can't replicate study results and insights from one cohort in another cohort. We simply find differences. Now, you can blame the methods on that, or maybe it is just the variability among the cohorts that they captured by accident. That is nothing only for microbiology, but it also applies there in a strong way.
With my forehead resting on that bolster to really feel a sense of calm and stability.
Okay, not to forget the genetic variability, for example, in neurological diseases. I brought neurological diseases because there is a crosstalk to mental well-being before you have a disease. And you find in certain diseases pathogenic variants that lead to a higher probability that you can get this disease. It's not only neurology, it's also autoimmune diseases, for example, as we are here in the United Emirates. Autoimmune diseases and some kind of polymorphisms in a gene, immune-related gene. Now, what to tell people who have that genetic makeup and you come with a biohack that works for some people for mental well-being, and maybe they also have an autoimmune disease and just can focus on that biohack. I mentioned MRI and the brain structure, and it turns out that you also find differences when it comes to intelligence. Okay, everyone wants to know what is intelligence, how can I become more intelligent, or is it inherited? Yes, it is in parts. And the fun fact is there are several areas in the brain that are good predictors for intelligence. And intelligence leads to different health outcomes, which means some people are more capable to make use of a biohack because they understand the purpose and follow the instructions. They can adhere to the biohack regime, and other people have problems with understanding and with compliance, with adhere to the biohack. They don't manage to change their behavior. I don't want to say if you don't manage to follow a biohack, you're not intelligent, but there is a certain percentage of people who are just not capable to follow the protocol. Overall, if you see tons of studies, tons of cohorts from the real world beyond academic area, you see that nature uses randomness. And this even has a function that improves our survival as human mankind. I don't want to bother you with statistics, quantitative methods, or statistical learning theory, but what I want to say is there is in us, in every one of us, there are randomizers inside and outside the environment, leads to mistakes, leads to challenges for our biosystems, and our biosystems have a variability of randomly collected responses. That response is a shortcut. Overall thing, don't nail me down to the details due to the lack of time. But in the end, among these randomized patterns, one pattern might be the answer to an external challenge. And that's why nature, obviously, and evolution uses randomness in all of us. Also in all of us of a species as a species. So you see some people, they never had problems with COVID-19. Others died. That was a function of that. Now you may ask me if Rudi says no biohack works for all. Do I have one personal recommendation? And as my introduction statement said, don't apply your individual case, just give you food for thought, what to do. Are there biohacks? Are there criteria for biohacks that have a good probability to work? And I say yes. So the first biohack is spend more of your money into preventive monitoring. It doesn't make sense to do anything from supplement to whatever, as long as you don't know what is your situation. And many laymen and consumers, they just read something and do something, while they miss maybe the real problem they have. They go for vitamins and they never check their iron and ferritin levels in the blood, for example. So instead of planned action, go to a preventive lab if you want, and if you have the time and the money, go for genetics and epigenetics. I would recommend a high-quality diagnostic procedures from physicians before any intervention. So don't let yourself talk by your pharmacist, who has not done any diagnosis, of course. If there is something, one biohack that is really recommendable is get a second opinion from another expert. Most of the time, that helps you to get a better picture and a better interpretation of your situation. That is maybe not the biohack you expect in a conference like that, but okay. As you have heard, I was with a large hospital chain, so maybe that is our biohack. Almost all healthcare systems in OECD countries offer prevention programs for free. Use them. No one likes to have a colonoscopy. I would say whenever it is in your coverage, do it. You heard about sleep and socialization from the centenarians cohorts? Yes, that most probably will work. When it comes to physical activity, the world is full, tons of studies, moderate physical activity, but you need enough dosage. Everything is better than nothing. One biohack that is not so very well known, brush your teeth. We have strong evidence that pathogens and the oral microbiome raise the probability to get a neurodegenerative disease, and also influences your gut microbiome with consequences for your long-term health. So you need shiny teeth that are healthy. And when it comes to diet, the evidence is overwhelming. This Mediterranean diet in your ethnical variant. Mariam yesterday said, okay, an Indian Mediterranean diet might look different than someone from Italy or Greece. And my last slide. Who is a super biohacker? We always heard about biohacks, but how could a biohacker look like that is a super biohacker? What kind of criteria must someone fulfill to be a biohacker? He should have plenty of health data to analyze his biohacks from patients and healthy people. He should have various ethnicities. In an ideal world, he could govern some lab protocols to avoid noise by different labs. The super dream would be someone who can afford a biobank. He should have, if possible, coding real-world data from patients in acute hospitals and in outpatient sectors, and the capability to obtain other data classes like the gut microbiome and the oral microbiome. If he starts a biohack, at least he needs the financial power for 7 up to 10 years to get longitudinal insights. And he should be open for IT, all kind of IT, sophisticated artificial intelligence, big data, new data classes skills. And as the data is always a little bit difficult to handle, he should be capable of doing data curation. Which leads me to one, assume that can only be a healthcare system or a medical society within a healthcare system that is supported by the healthcare system. Okay, that's it. 1 minute too much. If you want to contact me, find me here. Or, yes, this is a LinkedIn link. Thank you very much.